Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, and with me today is our Health Director, Marty Golightly, and our Public Health Nurse, Lindsay Wright. Welcome aboard.
Thank you.
Right.
We're going to start off in the usual fashion, and Lindsay, I'll ask if you could provide us with an update on our current numbers.
Absolutely. So currently we have 22 active cases. We have 2,226 cases that have been removed from tracking. We have a test positivity rate that was updated yesterday that is 3.79%. And then vaccination numbers was updated last week. We were waiting for numbers for this week. So we'll update that tomorrow. But from last week, the percentage of all eligible residents, so those residents who are 12 years and older, is 68.45%. And that ends up being, the percentage of all Abington residents is 59.14%.
We're creeping up to that 60% benchmark, but not quite there.
Slowly getting there.
The breakdown is about the average age is about 35.8. At my last count, we had 7 cases from the age of 0 to 18, 11 from 19 to 64, and 4 over the age of 65. And 6 of them were vaccinated. So please get your shot. And the cases that were 0 to 18, the average age for that was about 14 and a half.
And our positivity rate has gone down from last week, so that's a good thing.
And just friendly reminder that it is a 2-week rolling average of the test positivity. So indicators going down in our town is tracking and trending with the overall countrywide trend that our numbers of cases are trending downward. Looking at the forecastings on the CDC website, it does forecast that the models at least support a downward trend. Also, hospitalizations are trending downward. Deaths have not exactly started to trend downward because they lag cases, and the exact time frame for that lag is kind of hard to predict, depending upon how long someone can fight the disease. And our numbers are also very similar to surrounding communities, which is really good in both case numbers and test positivity rate. So if we're all trending down in the same direction, that kind of adds another layer of protection.
Excellent. So one thing we like to do here in the Health Department Roundtable, being of a certain generation, we know that knowledge is half the battle, and we like to try to get the facts out to people. There's a lot of information out there, most of it good, some of it bad, and it's our job here to try to keep things clear. So I'm going to turn it over to Marty and Lindsay to address some of the current discussions going on around COVID and precautions for that. So if you guys want to speak to the science.
I'll keep it relatively brief on my end. In a little bit of depressing news, America rates number 48 in the world in vaccinations, despite supply not being our problem whatsoever. It is primarily uninformed skepticism and just a mountain of misinformation. So if anybody is interested in peer-reviewed studies or learning anything, please let me know, and I will happily give you everything that I know. And what I'm basing opinions on is only the things that we can believe in and trust, as far as I can find them, and I will share them with everybody so people know exactly how I form an opinion. And I still can't believe we're having the masks don't work debate. If anybody has any peer-reviewed scientific articles that clearly state masks don't work, please send them to me. I would love to read them. And there's a lot of misinformation about certain studies out there that either the data is misrepresented or it's just incorrectly cited. So if someone has questions on a study mentioned, or they have questions on the outcome of a study that they think is counter to what I'm saying, let me know, and I will walk you through how we got there, and I will clearly state as best I can why it may not say what you think it says. And I'm happy to help with that, and I will do that to anyone that's interested. Also, another real quick thing, we have given out, we in the collective world, there has been 6.24 billion COVID vaccines given worldwide in a very short amount of time. The evidence clearly indicates that the vaccine is safe and effective. And if anybody has any questions about that, please let me know. This is how we get out of the pandemic. It is the unvaccinated that are mostly in the hospital. We're going to have some breakthrough cases. That's just how vaccines work. You can still get pregnant on birth control. That's just how these kind of things work. It is a layer of protection. Speaking about masks in environments, masks are one mitigation strategy. You have to have several mitigation strategies, ventilation, distancing, to make them more effective. By and large, all of those things together can lead to a very lower viral load in any of the spaces that people seem to congregate. And I hope I made that clear. Hospital settings, healthcare settings are going to have significantly more virus in the air, on things, than pretty much anywhere else. So the chances of getting COVID in a hospital are significantly more higher than anywhere else because of those factors, which is why hospital workers have to wear layers of protection beyond just a simple cloth or a simple surgical mask.
Marty, I'm going to.
Please go ahead. I was going to talk, and I'll talk about DESI and the DOE after this.
No, I'm going to jump in real quick. You said layers of protection, and the reason why we do things, again, the collective but a great way to relate it to something that kind of everyone knows about is Swiss cheese. It's called the Swiss cheese type of protection. Everyone knows that Swiss cheese has some holes in it. So if we stack a whole bunch of slices of Swiss cheese, we get a concrete level of protection. So we know that masks themselves aren't 100% risk mitigation. I'm sorry, risk elimination. They are a risk reduction tool. We know that distance alone doesn't eliminate the risk. It helps reduce the risk. We know that vaccines don't eliminate the risk. They help reduce the level of illness that people are experiencing. We know that all of these things combined is how we're going to get to the other side. And so we refer to it as the Swiss cheese model. When you look at, there's a great, I will have Chris put it online. I will find the graphic for it. It's a great graphic explaining this Swiss cheese model. And it just goes a little bit into more in depth than exactly what Marty was just talking about, how we layer everything and it all works together.
And earlier this week, DESI put out new mandates that the mask mandate will continue until November 1st, or until a school can reach that 80% vaccinated threshold. Talk to the superintendent of the school. We're going to do our best to try to get the schools over that 80% as fast as we can. We will continue to offer vaccination clinics. And then as soon as the 5 to 11, which could probably be as soon as 2, maybe 3 weeks from now, the EUA comes from them, we'll also have vaccine clinics for that population, getting closer to that 80% model for all the schools. And then we'll turn in our attestation forms and try to get our kids out of masks in the schools with that higher than 80% vaccine rate. And I've already talked to superintendent. I think we can get there. We'll just need some cooperation. And I think that cooperation is better served with education and knowing exactly the risk level is extraordinarily low. And again, anybody needs any specific information, or they would like to dispute, let me know. Send me the peer-reviewed studies. I would love to read them if you have them. Also, just because we don't report Abington's deaths or hospitalizations does not mean they're having them. We don't have any. It is something we choose to do is to not make the people who are going through some of the worst parts of their life, we don't want to have them make them relive that trauma over and over and over again. And one of the things that is hurtful to those people who have lost family members and friends to the disease is hearing other people say it's not real or minimizing it on such a high level. So I would just ask that we could be better neighbors to the people who have lost loved ones in town, because it has happened, and it has happened way more times than any of us would ever want. So if we could just be a bit more respectful about that, it would go a long way in keeping people from reliving trauma repeatedly. That was a really kind of depressing. I'm sorry. And I normally we keep these like, a little bit more upbeat, but forgive me.
No, I'm gonna just piggyback on that a little bit. We don't talk about when we talk about removed from tracking, we keep it as removed from tracking. We don't discuss what that exactly entails. And we do that specifically to protect our residents' privacy. And in doing so, we hope that our residents would understand that the same level of professionalism and empathy that we give to our families who are undergoing immense stress and grief, if their families were experiencing the same terrible situation and loss, we extend the same courtesy to every family that goes through this. And so to minimize it not only hurts the families, but for me, and for Marty and for Chris, who are in the office taking the phone calls, it's hard for us. I'm going to speak for me, to be the nurse on the phone, answering these phone calls and walking families through some of the hardest times that they'll go through. It's hard to hear that this isn't as big of a thing as it is, and not every case is as critical as others, of course. There is varying degrees of illness. Of course, we have cases who are asymptomatic, and we would hope that all cases experience that lesser illness, but the reality of it is we don't. We have cases that run from asymptomatic through to the worst possible outcome. And I would hope that all of our residents understand that when we stay quiet, it's because that's our job. When I took the position as the public health nurse, when Marty signed on to be the public health director, and we are in the midst of a pandemic, part of what we do as health professionals is we protect privacy and we give the best care possible. And part of that is not divulging the secrets of what's happening. And it's not meant to be disrespectful. It is meant as that's what we do, and we keep it in and we keep it quiet so that it doesn't upset anyone.
And when she says divulging of secrets, she's specifically talking about
medical
information of the people in town. There's no secrets from the side. The thing base our entire recommendations, our medical decision making, basically our lives in the office is three things: science, research, and evidence-based best practices. It's on the board when you walk in. It'll be the first thing you see. We use those three metrics as to figure out what the next best step is. Is the science indicating that? Does the research support it? Is it an evidence-based best practice? That's how we go down the line to figure out our course of action, because that is the smartest way to do it. We don't let anecdote, we don't let stories influence. We go by the evidence, the research, and the science. And anyone making extraordinary claims needs extraordinary evidence. So we're doing our best, and we will continue to do so. And if you have any questions, 781-982-2119.
Yeah, we're happy. Oh, sorry. Go ahead, Chris.
No, sorry. Go ahead.
I would love to think that we are super approachable. Please give us a call. Again, how many times have we said it? Our knowledge does us no good if we're not sharing it. I went to school for this so I could use what I see as my passion. I spend a lot of time outside of my work hours reading and studying and learning, not because I have to, because I want to learn better. I want to do better. I want to learn more. And I want to share that knowledge. I take everything I do and I treat it seriously. And so if I can read one extra study and be that much better for our town, then that's what I'm going to do. And I would love to be able to share that. So if anyone has questions, please just call.
I think that's a kind of a missed point too, is I don't know if people know this, but Lindsay and I both have health education backgrounds. I was a teacher in the military. Lindsay was an ER nurse teaching all those young interns in the ER. So it's not something we're altogether unfamiliar with, the education aspect. So please let us know. We're also both Red Cross instructors. We're all those things. So teaching is part and parcel to this gig. I know I look really young, but I've been doing this for 26 years.
And
go
ahead. Sorry.
I apparently look a lot older than I am. I was told today I was substantially older than I was, but I have been doing it for quite a while as well, and have a lot of knowledge that I'd love to give out. I sometimes unsolicited, but
ask questions and we will do our best to answer. Sorry, Chris, go ahead.
No, that's all right. And I just want to remind people that we are all neighbors. There is no us versus them. We're all in the same game here. We all have the same goal. We're trying to look out for each other and keep ourselves healthy. So let's remember to try and work together. And everybody has bad days. We're professionals, but we're human too. So Marty and Lindsay, I want to thank you very much for joining us once again. I hope people enjoy this and this is helpful. If you have any specific questions that you would like to see us address or topics, please let us know directly here at the Health Department. You can reach us online through the town website, or as Marty mentioned, at 781-982-2119. We're always happy to help. Unless either of you have anything else, I think that wraps up today's edition. Thanks for joining us, and a thanks to Abington Cam for hosting us as usual.
Yes, thank you.
Stay safe.